Back 8:41 this morning. November is National Diabetes Awareness Month. It's a time to highlight the importance of both treatment of the disease as well as the importance of preventative care. Joining me this morning are Dr. Meredith Taylor next to me and registered dietitian Alexis Horton, both with the Jane Pauley Community Health Center. Good morning to the both of you. Appreciate you coming on. This is such an important topic to talk about. Dr. Taylor, I want to start with you first because before we came back, there are some types of diabetes, and most people get them confused, type 1 and type 2. Kind of explain what they are.
Yeah, type 1 diabetes is most commonly found in children, and it's autoimmune driven, meaning that your body doesn't make any insulin, which you need to reduce your blood sugar. Type 2 diabetes is much more common in adult population, and you don't respond well to the insulin that you make.
Well, type 2 basically means it's largely preventable.
Correct.
So what can you say as a physician for people who are out there that are living with type 2 diabetes right now and the future of trying to get better?
Yeah, a lot of it is diet and exercise, and we have a lot of great treatments now that we can do. So it's just 30 minutes a day of exercise and trying to watch what you eat.
Yeah, and it sounds so simple, but for some people it's so hard. Alexis, let's talk about the role diet plays in preventing diabetes.
It plays a big role. So one thing that I would say is to limit like refined carbs or refined sugars. So the cookies, the cakes, the chips.
Just right around the time of the holidays.
Yes, and I'm telling my patients, stay strong during the holidays. It's okay to eat. Enjoy the things that you enjoy, but try to limit them. You don't need to overeat, basically.
You have to be disciplined.
You do. You have to, and it has to be important to you. And I tell them to start small. So if you are drinking a Coca-Cola 3 times a day, 7 days a week, let's try to dial it in. Maybe just 1 Coke a day. And then before you know it, you may just have 1 a week. And so little small changes like that make a big difference.
And speaking of those changes in the diet, what are some of the things that you do recommend? I mean, 3 or 4 Cokes a day, that for some people that's normal.
It is. They love their Coke. So things that I would recommend is eating a balanced diet. So having a protein, a lean protein like chicken breast, fish, salmon. If you want a steak, try to do a leaner steak and not the nice marbled fatty steaks. Having some non-starchy vegetables, your broccoli, your carrots, your spinach, things like that, and having a good carb of choice. So that could be like a russet potato or a sweet potato or rice or anything like that you enjoy.
And this is not something that you eat for a week and voila, everything is better. This is something you have to continue at.
Exactly.
And be disciplined, as I said.
Exactly. I always try to encourage them. A lifestyle change is the goal, not just a 2-week diet.
A lifestyle change indeed. Dr. Taylor, what are some of the treatment options for type 2 diabetes and diabetics?
Yeah, we have a lot of pills that people can take, like metformin and medications like that. There's some newer drugs that are also associated with weight loss that can really make a big impact on diabetes right now.
Well, just locally, Eli Lilly is based here, Zepbound. That announcement came out where they will be able to help for those who are dealing with obesity and diabetes issues as well. What are some of the symptoms? Because that's one thing that people don't know what to look out for.
Yeah, if you notice that you're more thirsty than normal, if you're going to the bathroom more than normal, those are some of the things that trigger us to think that your blood sugar may be going too high.
And are there any things that people can do? Who should they call?
Well, if you notice those symptoms, call your doctor. We can get some screening tests done. They're very easy and simple. And even if you find out that you do have diabetes, there's so much that we can do right now to take care of it.
All right, Dr. Meredith Taylor and registered dietitian Alexis Horton with the Jane Pauley Community Health Center. Thank you both for coming on this morning and talking about this important topic. Appreciate it.
Thank you for having us.
No problem. And for a look at all of the services provided by the Jane Pauley Community Center, just go to our website, fox59.com/links.